Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and I know firsthand as a family caregiver and part of the sandwich generation how tough it can be to take care of your aging parents while balancing your own life, career, and family. We'll bring you the experts and information necessary to help make your life a little bit easier and you a little bit smarter. Synergy Sessions is brought to you by Synergy Home Care, bringing you personalized in-home care and peace of mind to Silicon Valley families. I really do hope you enjoy the show. Hi, everybody, and welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm Tom Nelson, and I am very thrilled today to have Shawna Rodriguez, a certified geriatric care manager and owner of Bay Area Care Management, with us today as a guest. She has a really great tagline on her website, and I think it really fits for what we're all trying to accomplish here, aging smarter and also being in the sandwich generation. Life is a balancing act, and Shawna Rodriguez, Care Manager Certified, brings peace of mind, life balance to you and your loved ones while navigating the complexities of the aging process. That sounds amazing. Welcome to the podcast, Shawna.
Thank you. Thank you.
So I'm really excited about this because, there's so many of us who have stumbled into care managers, stumbled into care management accidentally as adult children, and we're all of a sudden find that we're helping our parents when our parents have always taken care of us.
Mm-hmm.
And you have actually chosen this as a profession on purpose. So first of all, thank you. I know many people in this, supporting seniors industry, you have a heart for this. You don't just do this. This isn't the way to make the big bucks. It's a calling. Can you tell us just a little bit about what you do and what your company does in general to support seniors at home as a care manager?
Well, I actually kind of consider myself as an aging life care professional. However, I'm kind of a surrogate family member, really. So I come in and I help out the families where they are either they're stumbling, they don't have the knowledge to know what the next step is, or they just emotionally can't do it because they're not close with their loved ones, but they feel obligated to do that. So I don't have that emotional connection and issue to deal with. So
right.
that's
Absolutely.
The difference there.
So who are your typical clients? Like, who's the typical person who would reach out to you or in that situation that you mentioned?
Sometimes it's the client themselves. They might call saying, I don't have the family, help me. A lot of times, though, it's the family members, maybe a daughter. I've had a daughter call me before saying, I hate my mom. I just can't deal with helping her, but I know she needs the help.
Right.
So that's where I come in and they say, okay, well, we need to take care of all of this. And I had a client, lots of clients like that, really, where the family members are just like, I just don't want to. And they can't. They don't have the bandwidth. They have to work. They have to take care of their children. They got newborns, whatever it takes.
Right. So that's kind of the overarching. So they're finding themselves in a position where either there's a family dynamic that the adult child can't assist, or the actual client themselves are having trouble staying independent in their own home. So what are the different components that you typically help people with? Like, what are like the different areas of service that you provide? Just because I think, a lot of times people maybe get an idea, but maybe kind of drill down just a little bit of exactly the type of things that you do.
So I actually come from assisted living. So that's kind of my background, assisted living and with Alzheimer's and dementia. So when I went into this, I thought for sure that would be what I was doing, assisting people with dementia, behaviors, and all of that. But I find that I end up at doctor appointments, right? Because those people with memory impairment, they can't remember what the doctor said. And even though there's like after visit summaries, there's still questions going on during that meeting that a care manager could come in and say, hey, what about this? What about that? This med isn't really working. This isn't really what's going on at home, right? So I'm kind of the eyes and ears for that person both ways, for their family members or for them, I lost it there.
No, that's okay. No, so appointments, well, you brought up a great point. So people with dementia, so they're just their organization skills, and also, like you said, going to the doctor and remembering maybe even what the
Yes.
doctor said. What other areas of maintaining their household do you help them with?
So I can come in and actually keep people at home longer by
Hmm.
saying, hey, you need home care. Maybe we can
Hmm.
bring in somebody for this amount of time. I assess the
Hmm.
situation, tell the family what they need. I had
Hmm.
one gentleman, he was at home and he only had caregivers come in maybe twice a week.
Hmm.
To then he had to go full time because he had
Hmm.
Alzheimer's and he was doing some strange things. And once we
Yeah.
realized this, then I was able to keep him at home as long as possible by utilizing home care and home
Yeah.
health. But then eventually it got to be too much, even for like one person to work with him. And
Yeah.
then I helped find the right community and help him move into a community.
Okay. Got it. So if a family member, adult daughter, like the person you just described, provides you the person to go, so their parent.
Right.
So what's your process from the beginning? So, maybe we can even take a step back.
Hmm.
So as a geriatric care manager or certified care manager, what is the special credential skills training? I know that I in my company had considered bringing that type of a service within my home care organization, but there's a lot involved with it. You can't just get this off the street,
Right.
So can you talk a little bit about of like the credential and the
Hmm.
training, what it means to become a certified care manager?
So through the Aging Life Care Association, there is the National
Right.
Academy of Certified Care Managers. They actually are particular about who they'll bring in. They'll bring in
Hmm.
nurses, they'll bring in social services, they can bring in people that have had some sort of history. They don't
Yeah.
have to necessarily all be of the same, but some sort of sociology kind of help, I
Yep.
think.
Hmm.
And then you go through this training. And so then I went through a training because of my background as a
Yeah.
caregiver. Then
Yeah.
I kind of moved up and then I went into a community, not a community, a home care agency that they did have
Hmm.
care managers, and that the care managers, they were either nurses and that's who they wanted, was a nurse to
Yeah.
come in. But I didn't have that, but I had a lot of this life health history. I'm
Right.
not saying it correctly, but
Yeah.
so
Sorry.
social background.
Yep. Yep.
And so with that, you can go to the National Academy of Certified Care Managers and
Hmm.
you can go through the education and get certified through them after taking an exam.
Right. So one of the biggest requirements I think that I observed that you just mentioned is you either have quite a bit of experience
Hmm.
in the field and or an education. So
Yes.
someone who's a social worker, if you have a
Hmm.
degree in social work, or you have a degree in gerontology or some of
Hmm.
those things. This isn't just a weekend certification type thing. So you're coming from a
Right.
perspective of not only the training, but also the life experience working in this industry. And then I think you need to have at least a certain amount of work experience as well,
Hmm.
even if you have a degree, before you
Right.
can get this certification, which I think is really
Yes.
important because there are other certifications out there, senior advisors and things
Hmm.
like that, where you get a good overview of working with seniors, but this is just a different level, a different depth
Yeah.
of understanding and education.
And really the difference is more like the medical side of things, the day to day
Hmm.
medical things, like the
Yeah.
medications. People should understand the medication,
Yeah.
where that's where a nurse comes in handy,
Yeah.
right? But I've
Yeah.
worked with Alzheimer's dementia and I know the history of medications with them, so that's kind of how I did it. But
Right.
when I went to get certified, I
Hmm.
had to have a bachelor's degree. I had to
Hmm.
have bachelor's degree in one of these fields.
Right.
And so it was kind of iffy because I did social science and I had sociology and, all of this behind me, family studies, but they almost
Yeah.
considered it not being relevant. And I'm just like,
Hmm.
why?
Yeah. Yeah.
So yeah, but they took it and I got
Yeah.
certified and I did the exam. And yes, um I was under Steve Barlam, who's like the
Mm.
guru of care managers.
Okay.
So he's the person that he brought me into his home care agency and really
Hmm.
showed me that this is what I wanted to do and I
Okay.
could do it.
Right. Well, I think it takes a very special person because of all the different dynamics. What are um what are some of the ways that you work with let's say the adult children to make sure their parent has the best care possible and they're feeling in your tagline there, the peace of mind.
Right.
Say they're out of state or
Mhm.
something. What's your process there as far as making sure they're in the loop and you're getting communication and all that?
Well, once I do my assessment of the situation, right,
Hmm.
I find out what's important to the client. I find out what's important to their family. I
Yeah.
work as a team member. So we work
Hmm.
together as a team. I have
Right.
some families that really only want me there for consultation because
Hmm.
there's three family members that don't agree on everything, what's happening for
Sure.
mom. And
Yeah.
so I'm more of like the mediator for them. And this is why we should do this. And this is what
Hmm.
happens and blah, blah, blah. Then there's
Right.
people that just say, you take care of them. Call me when there's an emergency. I'm the
Yeah.
emergency contact. And then for some
Okay.
people, I can even be the durable power of attorney for healthcare, not for
Got it.
financial, but for healthcare. So it just depends on how involved. And so once I get that established, then I work out of I just send you like a weekly update. I send you a monthly update. I just tell you when
Yeah.
things happen.
Uh-huh.
I'll tell you every day when things are happening. It
Yeah.
just depends on the individual and how involved they want to be or can
Yeah.
be.
Is this a monthly type thing, or how is your service typically set up? I mean, do you have a certain schedule that you're with them, or does it really vary? I would imagine it
It
varies
does
from
vary.
client to client, but what's typical for you?
Right. So with one individual, I was involved and just kind of going over there and making sure she was safe. She was caring for her own mom, but she was drinking and just all these things were happening. And she is
Yeah.
also a little schizophrenic. And so she
Yeah.
kind of lost it. And when
Yeah.
she lost it, I had to be the one to come over and take her to like the mental health. So I took her
Hmm.
over there. She got involved. She was in mental health. She came out. I got her into another place and
Hmm.
now she's good. We just go for a lunch every now and then because she's on her
Okay.
medication
Yeah.
and she stays on her medication. And I just kind of follow up with that. And then I've had people where I'm like, I'm going to the hospital with them. I'm the one that's called, right? So and
Yeah.
so has to go to the hospital. They're in assisted living or at home or
Yeah.
whatever. Then I'll go
Yeah.
to the hospital. I'll make sure everything is being taken care of. I am there from the start all the way to the end of
Hmm.
discharge. Are they going home? Are they going to home care? I mean, home
Hmm.
rehab. Where are they
Uh-huh.
going? So
Yeah.
I get involved that way as well. I am I
Yeah,
missing?
well, I think that what you've
I
just
think
described is probably making a lot of people's heads spin. It's like you know how to navigate the system,
yes.
where a lot of people are just get, deer in the headlights and don't know what the next
Mhm.
step is. And I wasn't even aware. So you can you can parachute in case of emergency,
Yeah.
and get them on the right track. And then you can do just very light touch follow ups until they need you again. Or it sounds like you can be kind of quarterbacking their whole life on a regular basis and really taking
Right.
care of everything.
Yeah. So one lady, I go over to her house every Monday, make sure that her
Mm.
medications are all set up for her
Okay.
and help her just kind of oversee that. And then, we go to Pete's for a coffee and
Mhm.
like a
Yeah,
brunch, just and
got
that's
it.
socialization.
Yep,
So,
yep,
anywhere from podiatry to just let's get out of the house.
yeah,
Um,
that's great. So you're really improving their quality of life. So the things that maybe they can't do anymore, you're able to help
mhm.
facilitate that
Yes.
for them. So there's not only
Yeah.
doing the things, the
Right.
tasks,
Yes.
coordinating all the appointments and all those things, you're also providing some companionship and getting
Hmm.
them out and helping them do the things that they probably can't do by themselves anymore, but without having to hire, maybe a home care organization like myself, they just want to, have somebody they can go out with them
Right.
occasionally as well. That's
Yeah.
great. I think I love this. It's like a lot of just kind of complimentary type
Hmm.
services. And I think that's what it is to make sure everything's taken care of. If somebody is not in the area, so the actual person is not in the Bay Area. So our tagline is aging smarter in Silicon Valley. But if they're
Hmm.
not in Silicon Valley, what are the what are some of the things I would imagine since, the Aging Life Care Association, is a national,
Yes.
what should they look for in a care manager if they're starting to putting the word out or researching care managers? What are some important components that they should consider?
Location. Location is key. You know, You can go onto the Aging Life Care Association, put in the zip code of where your loved one lives or yourself. And then,
Mm,
you want to get to know that person. You really want to
right.
get to know them on a personal level. Like, you want to be comfortable. You
Yeah.
want to be comfortable and you want to feel safe with that person.
Right.
So it's really kind of just trusting in what they have to say.
Yeah.
I mean, really getting to know people. When I
Yeah.
have new clients, I want to get to know them on a
Yeah.
personal level. What's important to you? How would you feel safe with this? Like, I'm not coming in to start barking orders and telling you what you need to
Yeah.
do. We're going to work as a
Right.
team in this. And that's the way I come at. Now, I do know care managers that come in and start barking orders. They start saying, this has to be done this way. And sometimes that works. I've
Yeah.
actually, lost a client to somebody who
Mhm.
was like that because they felt that their dad needed something like that. And I'm
Right.
just not that person that's going to come in and do it,
Right.
you know?
Yeah.
And so I
That's a
think,
great point. It's not like a
yeah,
plumber. This is much more intimate, right?
yes,
Not just going in and fixing something.
right.
Like you said, that's the approach of some people, and some people need that. They need that,
Yeah,
you know, that I'm taking charge approach.
yes.
But it's so much more. You're getting very entrenched with their lives, and you're spending a lot of
Mhm.
time with them. So you want to make sure they're a good person fit too. It sounds like.
Yeah. And I mean, I have one client that honestly, she lives in an assisted living. And if I
Mhm,
don't see her at least once a week, or if I'm not talking to her, she
mhm.
really kind of it gets out of sorts and things
Yeah.
kind of change on a negative way. And I can't even
Hmm.
explain why. But when I go and
Yeah.
I sit with her and we communicate and talk
Yeah.
and, just have that interaction, then
Right.
I hear the staff say, oh, she's better today.
Yeah.
I'd like to think that's because of our interaction. And I feel that it is. It's
Right.
just, and it's really being heard by the person that you're working
Yeah.
with.
Right.
I think that if the care manager I would want for my loved one is listen to my
Mhm.
mom. If she says she
Yeah.
doesn't want to do that, that's okay.
Hmm.
So,
Yeah. Well, at the end of the day, it's you're trying to improve the quality of their life.
right.
So if it's something that they don't want to do, you know, unless you're talking about some type of a dementia or
Or
impairment
safety.
related reason why they're resisting practical, like
Right.
going to the doctor or something, that's different.
Hmm.
But
Hmm.
but yeah, I mean, it's really important to make sure that they're being heard. I know so many times that I've been in situations, and I know my team is so great at this. They're talking to the actual client, where a lot of times when you bring somebody in, they're talking to the adult
Oh,
child, like they're not even in the room,
yes.
which is so disrespectful and just it's really dismissive. So I love that you're saying that. You really
Hmm.
want to tune into like what their hopes and dreams are to improve their
Yeah.
own life, as opposed to what all their family members want them to do, which is
Right.
probably pragmatically important, but not all the
Hmm.
nuances of ways to improve them.
Hmm. And that
Yeah.
really, that came from being a caregiver. I
Yeah.
had one client when I worked at an assisted living as a caregiver, nobody would
Mhm.
listen to her. They were like, come on, we got to
Yeah.
get you up. We got to get you dressed. And
Yeah.
she was just mad. And
Yeah.
she was kicking me and all this. And I just said, well,
Yeah.
this is because I care about you and I'm
Yeah.
just trying to help you. And she would work with me where she wouldn't work with other
Yeah.
people. And I just
Yeah.
kind of think that that's how I mean, everybody wants to be heard.
Yeah. Well, I think that's the difference. I think you just nailed it too. The difference is you're somebody who's doing this as a chosen profession,
Hmm.
from caregiver on up to care manager, and it's that connection with the person.
Hmm.
I mean, clearly this is coming through with you, and these are the people that are the best. The ones that are going in and they're punching a time clock and they're on
Oh,
their
yeah.
phones and they're just trying to do the tasks.
Hmm.
They're never going to make that connection, and they're never gonna actually, I like to say, upgrade lives,
Hmm.
from where they're
Right.
at now. You're supposed to be there to improve things, not just to check the boxes. So
Right.
that's wonderful. What happens when, or what's the best way to phrase this? If someone waits too long, or maybe like how soon should somebody be inquiring about this? Maybe they don't quite need it now,
Mm.
or is it too soon or too late, or
Yeah.
what's the best time to contact you to maybe start talking about the process, about just getting connected to, so that way when they are in need,
Right.
they're already ready to go, as opposed to waiting for a crisis, which is usually what happens in
Mm.
my world.
It happens in mine too.
Yeah.
You can call it any time. I mean, if I
Mhm.
have a loved one that's out of state,
Yep.
I might want to just reach out to a care manager and say, "Hey,
Yep.
here's the situation. They're at
Mhm.
home.
Right.
I might need someone to stand in for me if something goes wrong. I'd love for
Yeah.
you to meet my mom or dad or whomever, my
Yeah.
brother, sister." I don't think that it ever hurts to just have
Yeah.
them meet. It's hard for people to give up their independence. So what
Yeah.
happens a lot of times is just somebody will say, "Well, I don't need that."
Right.
Okay. If it's the right care manager, they'll go in and say, "I know you don't need this now, but,
Mhm.
let's just kind of meet
Yeah.
and see where it goes. And if you don't
Yep.
need me today, that's okay. If you need me in 3 weeks or 3 months, 3 years, that's fine too." I think it's
Yeah.
always good to have like a backup plan.
Right. I think I think that's spot on, and just like you were mentioning earlier, you might just be there ready in the wings in
Hmm.
case you need to step in or have somebody there that already knows the person, knows the
Hmm.
situation, is already connected with the family,
Yeah.
and maybe they don't need full-time help, for years, but it's great to have that resource,
Hmm.
earlier on.
It is.
What have you seen? I don't wanna so I usually try to stay away from scare tactics to get people to do things, but what have you seen when people wait too long or don't do it? It seems like if the goal is to come
Hmm.
in to assist to keep people with the quality of life and independent in their home as long as possible. Have you been called when it's maybe too late or
Um,
they're too far along or
no, there's not really a too far along. I mean,
okay.
I've been called when there's been emergencies and someone's like, "I just don't know what to do." And
Yeah,
the biggest challenge is really to get somebody on board with the idea that
yeah,
I'm not there to take over your life. That's the
right.
biggest challenge. It's
Yeah.
not really, when
Mhm.
there's never a too late.
Right,
There can
right.
be, obviously, but not really. Even if
Yeah.
I've met people when they've just got on hospice and then I
Mhm.
just kind of help through the end of life, right?
Yeah,
I'm there to talk to the hospice agency. I'm there
right.
to educate the family on what's going
Mhm.
on. And this is what I
Yeah,
see. And, I think even then isn't really too late, right? No, it's just the biggest challenge is just getting
yeah,
on board.
right. Well, it seems like you're able to work with anybody regardless of what stage, because maybe if they are later on, that you might assist them at transitioning to another
Yes.
facility or help them navigate the hospice question and those
Hmm.
types of things too, which is all of those services or all of those perspectives are very, helpful because
Hmm.
most of the time people are just, like I said, they're overwhelmed during
Yeah,
visits,
they are. And
so it's good to have somebody.
even if their loved one is on hospice, and let's say that I come in and, if you're out of state, you only hear that they're on hospice. You're only hearing
Yeah,
what's going on, right?
right.
To have somebody in there that actually understands the process of
Mhm.
end of life, then it's going to make it like you understand a bit more.
Yeah,
I mean, I
yeah.
had a lady that was in the hospital. She was in and out of the hospital. And the last time she went in, I literally called the daughters and I said, this just feels different.
Mhm.
And at first they were like, "No, no, no." And then they talked to the doctor and they were like, "This is different." And then they came
Yeah,
out and they were actually able to be with their mom at the
yeah,
very end.
yeah,
And I even told them, I'm like, if this plan is that you need to be here, then you should come,
yeah, right.
and if
And
you
there's
don't
really
need to
no
be, that's okay
substitute,
too. Sorry.
right?
You know?
And I was gonna say, and there's really no substitute for having eyes and being with the person. So, when
Hmm.
you're out of state, you're just on the phone,
Right.
everything's fine, and then you get in there, you can actually see them and be with them, and you have a more intuitive around, like, as you just described,
Hmm.
that you may need to come out or, this isn't exactly, how
Yeah.
you're perceiving from a phone call, which is a
Right.
lot of times very hard to assess a situation on a phone call. Um,
Right. And also, I mean, none of us know when anything is going to happen, really.
right.
But when you've been around it a lot, then you absolutely can come in and say, something's a little different. Jamon's talking a little different. She's reacting a little different.
Yeah.
And yeah, and it's just really a complicated thing to go through.
Well, also, I can tell you that there's usually a big spike in my business right after the
Hmm.
holidays, because
Oh,
that's
yes.
when people come and see their loved ones, and then they say, "Oh, wow,
I had
the
no
wheels
idea.
have really come off since the last time I saw." And
Mhm.
again, they didn't really ever pick up on that over a phone call. But
Right.
when you come into the house and you see, how's their hygiene? Are they keeping up the house? Like all the
Mhm.
things that they normally
Mhm.
would manage, now they're not managing anymore.
Right.
So that's a great point to be able to do that. You mentioned that kind of a misconception was that you would come in, or a care manager would come in and just take charge and do everything. And you've done a great job at dispelling that myth. What other misconceptions or maybe concerns are out
Mm.
there that you run into that maybe you can help dispel as well?
Well, families go through, this whole guilt. I have to take
Yeah,
care of mom, as I mentioned earlier, right?
yeah,
And I don't like mom or whatever.
yeah,
They might
yeah,
love mom, but they don't know how to
yeah.
deal with mom. And
Sure.
so the misconception is that, like, I'm just like an extension of the family. I'm just an
Yeah,
extension of you as a caregiver, and I
right.
know a little bit more, right?
Hmm.
So if you're taking care of your mom and I come in and I'm helping out, I'm not trying to take away from you. Like, that's
Right,
not my role, is to take anything more from you than you want me to take.
right,
So
right.
that's a big misconception too. People feel guilty if they have someone
Mm-hmm.
else coming in and
Right.
helping. And it shouldn't be that way. It's just like, I'm providing a service that you can't provide, and it's
Hmm.
okay that you don't know how, right?
Right.
And I'm just here as a consultant, an assistant,
Hmm.
as anything that's needed to get the job done and have that
Right.
quality of life good. And and I noticed that when I worked in the assisted living, people would come
Hmm.
in, "Oh, I feel so bad if I place them in this community." And it's like,
Hmm.
no, we're just an extension of the
Right.
caregiving that you're doing now,
Yeah.
but I know how to do it
Yeah.
where maybe you
That's a
don't.
great point. That guilt, and we've talked about this. I've had some of my other guests in, with Alzheimer's and
Mhm.
caring for those with Alzheimer's, is there's a lot of guilt because, as you mentioned, having them move to assisted living when they've, swore to each other
Yep.
that we would never do that. We'll never put you in home. I'll take care of you.
Mhm.
But at some point, it is
Yeah.
overwhelming, and I'm starting with these podcasts, I'm starting to see a lot of a common thread that caregivers there's the guilt, they're
Mhm.
overwhelmed, they don't know what they have to
What to
feel like
do.
they're doing it on their own, and I think hopefully talking to people like yourself and
Mhm.
others that there is support in all these different dimensions. So there are community resources, care management resources to help and partner and collaborate with the family or the
Yeah.
individual to
Right.
help them live their best life. I think this is the exact point of why we're doing this podcast,
Mhm.
because it doesn't, you don't, so here's my big tagline: you don't have to do it alone.
Right. Well,
There's
it takes a
nothing
village,
that says, yeah. What's
you
that?
know? It takes a village.
It takes a big village for sure.
It does.
So, is there anything that we haven't talked about yet that people should know about Bay Area care
Um,
management or your services as a care manager?
well, someone could call and just ask
Yeah,
questions, and
yeah,
I could be, any care manager,
yeah,
they could call in that area and just see kind of what options are there. Just any kind of
yeah,
questions,
right.
you know?
Well, I think there's people that are thinking about their specific situation right now
Yeah.
that we're not gonna cover every, nuance that's out there with each type of client,
Right.
but we will definitely have all the ways to contact you in the show notes,
Yeah.
and I would absolutely encourage anybody that is interested in learning more about this. It feels like, wow, this could be really helpful for me and my family and
Mhm.
taking care of my loved one, to reach out to Shauna for sure. Again, we'll have all the information.
Yeah.
Unless there's anything else that you're feeling like we glaringly omitted on
Mm,
this, but I think I've learned a
mm.
lot, and as far as just the breadth of the services, because I too thought with certain care management, this is kind of the scope what we do, but it sounds like you're a little bit of help all the way to a lot of help, whatever's needed for the family to help them.
Yeah. I mean, like I said, a big thing is emergencies, going to the ER, making sure
Yeah.
that that's good. I mean, when people go to the ER and the nurses there and the doctors don't know this person, right?
Yeah.
That's a big thing. They don't
Right.
know, and they're, like they're asleep. And I'm thinking,
Yeah.
no, you don't know if this is baseline or not, you
Yeah.
know?
Right. Exactly.
So,
And most people you mentioned with clients with dementia or cognitive impairment, you're never going to get a straight answer out of
no,
them because they're usually like most people, honestly, they just want to please the doctor. If
right,
they are asking questions, you're always going to tell them how you're doing on your best day, not on
right,
your normal, so,
exactly.
so, so it's great to
Yeah.
have you as that wing person to make
Hmm.
sure that they're getting the right information and everything.
Yeah.
Yeah. I mean, just like I think the benefits are clear,
Mm.
to have someone like yourself,
But,
especially if they don't have family
well, everybody needs an advocate,
or their family is not able to do the
right?
things they need to do.
And I really think everybody needs an advocate. I mean, I
Yeah.
was in the hospital and
Right.
I needed an advocate,
Hmm.
and I had that. I had
Yeah.
that. And I
Right.
looked at that later thinking, wow, every single person could use an advocate when
Yeah.
they're not on their, top game, right? They're in
Yeah.
pain. They don't know how to handle
Yeah.
it. And so
That's a
somebody can be
great
there.
point. And you know what? Now that I'm thinking about it, the next line after the first line that I read is that you're an advocate, which I think is huge because you're right. You don't value that piece of it until
Hmm.
you're in the situation where you're
Right.
out of sorts, you're in the hospital, you're trying to talk to your out of state kids or whatever. And then to have someone like yourself to come in and say, okay, this is what this person needs. We're not leaving until blah, blah, blah.
Exactly. Done that.
All those things that you need
Yeah.
the person that feels comfortable in that role
Right.
to take on, whatever administrator or doctor or whatever,
Hmm.
of course, in the most constructive and productive way, but to make sure they're getting what they need.
Yeah.
And
Yeah.
you're their advocate. That's amazing. Yeah,
Yep.
I'm glad we covered that because that's something that I think is so important because until somebody is in that situation, you just don't even know how
Mm-mm.
valuable that is.
Yeah,
Awesome.
exactly. No,
Well, Shawna, thank you so much for being
thank
on
you.
Synergy Sessions. This was
Thank
amazing.
you. This was exciting.
Like I said, I learned a ton, and I feel like this is a service that many people would benefit from. And even if you're not sure, reach out to Shawna. We'll have all her contact information to maybe discuss your specific situation and see if there's a way that she can help out or give you some great advice on maybe something you can do.
Absolutely.
All right. Well, thanks again, everybody,
Thank you.
for being here for the Synergy Sessions, Aging Smarter in Silicon Valley. And remember, you don't have to do it alone. Thanks, everybody. I'll see you next time. Thanks, Shauna.
Thank you.
Thank you for joining us on the Synergy Sessions. We know you have a lot on your plate, so we really appreciate you spending the time with us today. If you found the information in this episode useful, please reach out to the guest or the resources in the show notes. I know they would appreciate it and would love to help. Also, if you have an idea for a future episode, please reach out to us on Instagram or Facebook or email us and let us know. We'd love to hear from you and provide information that's useful. Lastly, please remember, you don't have to do this alone.